I know of far too many stories that begin with heartbreak and end with regret, all because someone had a hidden factor that dangerously boosted their chances of breast cancer, and no one thought to inform them. I know of too many women who are no longer with us, one advocate lamented, merely because they weren't told the truth about their own bodies. That alarming statement captures the heart of today's story. A hidden risk that elevates your odds of breast cancer up to 6 times, yet often remains shrouded in secrecy. Why are some medical systems around the world quick to let women know about this threat, while others, like in the United Kingdom, seem content to leave it in the shadows? And how does this oversight affect the detection and treatment of one of the most feared diseases on the planet? Today we'll explore the little-known reality of dense breast tissue, what it actually means, how it might be making standard mammograms far less effective than you think, and why not all countries are equally proactive in warning their citizens. We'll see how real women's lives are impacted when the very technology meant to protect and reassure them instead fails to alert them to critical warnings. In this segment, we are going on an in-depth investigation. We'll dive into the science behind breast density, examine how small changes in screening protocols could potentially save countless lives, and question whether there are hidden agendas or mere bureaucratic stumbles that keep women in the dark. Stay with me, because by the end of this discussion, you may look at routine checkups in a completely different light. We'll delve into some of the most urgent questions surrounding dense breasts. Why is the presence of dense tissue so dangerous? How big a role do hormone changes play? And most importantly, who is fighting to force a call to action so that women everywhere can be told, and not just told, but provided solutions to counteract the increased risk? We'll also share jaw-dropping examples of what has actually happened to those who were never alerted to their condition, as well as the success stories of those who did receive extra screenings in time. By connecting all these points, we intend to spotlight the truth about a risk factor that could well be right under your nose. Let's jump right into the core of this issue. Dense breasts sound innocuous enough, but they hide an unsettling combination of higher cancer risk and dramatically reduced efficacy for standard scans. Essentially, breasts are composed of fat and fibrous glandular tissue. When there is only a small amount of fat and a larger amount of glandular tissue, the result is dense breast tissue. From the outside, it's practically impossible to detect. You cannot look at someone and just know that they have dense breasts. Instead, only specialized imaging, such as a mammogram, can clarify this distinction. And here lies the challenge. In a mammogram, tumors tend to display as white. Unfortunately, dense breasts also present as white in these images. This is the nightmare scenario of trying to spot a tiny snowball in the middle of a vast snowstorm, a metaphor doctors repeatedly invoke when describing how elusive these tumors can be. Now imagine you go for a routine test. You hear the usual advice, and you're told everything is clear. Yet behind the bright, cloudy patterns of dense breast tissue, there might be a small but growing tumor that the machine can't readily pick up. Worse still, because of how standard screening programs operate in certain countries, taking place only every few years, by the time the next check rolls around, that elusive tumor could have doubled or tripled in size, spreading to other parts of the body. The real travesty, according to numerous campaigners and medical professionals, is that in some parts of the world, medical authorities still don't inform women about their level of breast density, even when that information is plainly visible on their mammogram. Instead, a woman might hear she is all clear without the critical context that certain abnormalities might remain difficult to detect. Remember, breast density is influenced by factors like hormones. As a woman grows older and enters the period around menopause, levels of estrogen shift downward, typically lowering density. But if someone is on hormone replacement therapy or has a genetic predisposition that leads to denser tissue, that effect can be counteracted. Certain research suggests that as many as half of women aged around 50 or older may fall into the categories that indicate significant density. But clearly, it's not only about risk. There is the frightening problem of detectability. Various studies, including those published in respected medical journals, show missed cancers in about 40% of highly dense breast scans. That statistic alone should make any concerned individual pause and wonder, how is this not immediately disclosed to each patient? Before we answer that, let's highlight the emotional toll this secrecy can take. Consider a woman named Susan who had a standard mammogram that read as normal. Fast forward 7 months. She suddenly experiences excruciating back pain, something that seems utterly unrelated at first glance. She rushes to the hospital only to discover that not only has she developed a tumor in her breast, already the size of a strawberry, but it has also spread to multiple sites throughout her body. This advanced stage of cancer is no longer curable, leaving her pleas for an explanation. How was I told I was fine when this was obviously not fine? It is a reaction that no one should have to endure. Her quandary stands in stark contrast to the experience of Louise, who also had dense breasts. Thanks to a research study that acknowledges the additional risks for women in that category, Louise received extra scans, specifically an MRI that involved the injection of a contrast agent. These scans revealed 6 tiny cancers so small that, as Louise describes it, each was about the size of a grain of sand. Because they were caught early, she underwent a relatively short course of surgery and radiotherapy, quickly getting back on her feet with minimal intrusion into her daily existence. That difference, between losing precious months or years of one's life to an advanced and incurable diagnosis versus addressing the disease swiftly and effectively, illustrates exactly why transparency about breast density matters. This inconsistency in the approach to dense breasts is also evident across different nations. In the United States, a federal rule now mandates that after a mammogram, women must be informed if they have dense breast tissue, along with a direct warning that dense tissue can make it harder to spot abnormalities, and that it raises the risk of developing breast cancer in the first place. In places like France, Switzerland, and Lithuania, meanwhile, if a woman is found to have significant breast density, she may be requested to return for additional ultrasound scans. Yet, as critics in the UK are quick to point out, the National Health Service screening program typically does not communicate that crucial finding, nor does it automatically offer the extra imaging that could potentially save countless lives. At this point, you might be wondering, how can this vital data simply be left out of a patient's notes? Some doctors argue that they do not want to cause unwarranted anxiety. Others cite the shortage of specialized equipment or staff to perform more advanced imaging, making the suggestion of routine ultrasound or MRI for every case of dense breasts challenging. Moreover, there is concern that too many extra scans might lead to false positives, creating a flood of stress and further invasive procedures that do not necessarily benefit the patient in every instance. Still, for many advocates and survivors, any possible downsides pale in comparison to the heartbreak of missing a lethal tumor. And crucially, this secrecy strips patients of the right to decide for themselves how aggressively they wish to handle their own risk. Now, let's zoom out for a moment. We've outlined the startling mismatch between risk and detection. We've learned from Susan's tragedy and Louise's salvation. We've seen that in the United States, it's a legal requirement to share this information, whereas in the United Kingdom, you aren't likely to hear about it unless you specifically ask. It's time to examine the arguments behind this difference more deeply, focusing on the question, is it purely pragmatic to withhold that information, or is there a deeper inertia at play? First, there are indeed logistical conundrums. Telling every single woman the exact level of her breast density might require advanced classification, specialized training for radiologists, standardization of measurement criteria, and a robust infrastructure to follow up. Nations with more limited health resources might balk at the costs. Nonetheless, the question arises, with new technology, might it be feasible to incorporate extra imaging for those at the highest risk? After all, some leading experts do not suggest that every woman with relatively high density needs the most advanced MRI scans every few months. Instead, researchers propose more nuanced approaches, like focusing on the top 5% of women with extremely dense breasts or combining various risk factors such as family history or lifestyle habits to prioritize those who might benefit most from extra checks. Second, there is the broader theme of patient autonomy. Many breast health experts argue that a woman cannot truly give informed consent for her screening if she doesn't know how reliable that screening is likely to be in her particular circumstances. Dense breast tissue can effectively mask tumors, rendering many typical scans less useful. Without being told of this reality, how can someone decide whether to seek additional private scans or even push her healthcare provider for alternative tests such as ultrasound or MRI? The unilateral decision to withhold that knowledge robs people of a choice that might be life-saving. At this juncture, let's take a little emotional breather. If you found this story revealing, or if you've ever worried about something not being communicated clearly by a health system, consider giving this investigative content a like. It's one small gesture that helps spread awareness, especially for a topic that is genuinely crucial to so many individuals. Thank you for that. Now, let's resume. Medical professionals across the globe have come forward to urge changes, stating that it's no longer acceptable, if it ever was, to keep the presence of dense breast tissue hush-hush. We come across testimonies from experts like Professor Kefa Mokbel, a consultant breast surgeon who has researched how best to screen those with dense tissue. He highlights the importance of personalizing breast health management, explaining that if you know your particular risk is higher, you might also choose to make different lifestyle decisions, such as adjusting hormone therapy or being extra vigilant about checking for lumps. In addition, campaigns like Breast Density Matters UK, founded by advocates such as Cheryl Cruise, argue that structurally ignoring dense breasts is both callous and harmful. They say that while some in the medical community fear women might panic, the bigger sin is letting them take false comfort in a clear mammogram that might not be truly clear at all. Other recognized voices in radiology are baffled at the UK's stance. Wendy Berg, a professor of radiology at the University of Pittsburgh, admits she was stunned when she realized that many women across the Atlantic are left uninformed. As a matter of fact, she herself had dense breasts and was diagnosed with breast cancer that went undetected by a routine mammogram. Only through additional screenings was it eventually discovered. This personal experience transformed her into a vocal advocate for transparency. We also have the case of the popular television presenter Julia Bradbury, who was initially told not to worry after a mammogram, only for an ultrasound to detect a large tumor in her dense breasts. By that point, the tumor was 6 centimeters, leaving her with fewer choices concerning the type of surgery available. Julia wonders aloud, wouldn't it be so much better for everyone if women simply got the full picture in the first place? Between these real-life anecdotes, we see a thread of sorrow, frustration, and anger at the system, which ironically claims to champion preventive health but sometimes shortchanges the population on vital knowledge. Supporters emphasize that the solution doesn't necessarily require revolutionizing the entire breast cancer screening system overnight. Offering an ultrasound to those at high risk, or perhaps a contrast-enhanced mammogram or MRI, can be targeted and therefore resource efficient. Indeed, a promising study known as the BRAID trial was led by Professor Fiona Gilbert, involving thousands of women in the United Kingdom who had been identified with particularly dense breasts. They were offered additional scans, either ultrasound or more powerful imaging that uses injected dye, and the results were enlightening. Early detection soared, including the discovery of tiny tumors that might otherwise remain invisible. Analysis has shown that a targeted approach could detect several thousand more treatable cancers each year. So far, that trial's outcome is pointing in a direction that campaigners have long believed was the correct path. It may come down to a final decision. Can a shift in policy or guidelines be spurred by evidence from such studies and testimonies of patients? Will the UK National Screening Committee eventually endorse systematic reporting of breast density and follow-up tests for those who need it? Some government figures have hinted that a policy revision may be on the horizon, but many remain skeptical, recalling times in the past when inertia won out instead. Wera Hobhouse, a member of parliament who introduced a private member's bill calling for such reforms, is determined not to let the issue vanish. She argues that real progress will demand a united front. Clinicians, patient advocacy groups, legal experts, and most importantly, engaged families who demand to know the full truth. Still, one might wonder, is there a risk of going too far? Could telling every single person about their breast density lead to unnecessary alarm? Could half of all women suddenly demand expensive MRIs that might not be strictly necessary? According to many specialists, these concerns can be mitigated by refining the approach. The strategy is not to incite panic, but rather to communicate effectively so that individuals with truly high density pair that knowledge with other risk indicators, like family history, diet, or personal medical history, to decide if an ultrasound or additional imaging is justified. And let's not forget, doctors continually refine screening processes in all sorts of medical fields, whether it's colonoscopies, heart disease checks, or diabetes monitoring. So, why not incorporate this fine-tuned approach to breast cancer detection as well? Interestingly, as much as experts champion these additional screenings, they also caution that women should not abandon regular mammograms. Even in the densest breast profile, a mammogram can still detect many cancers. Rather, the call is to complement or refine the existing system rather than discard it altogether. Indeed, an ultrasound might do a better job of probing suspicious nooks and crannies, but a mammogram often covers a broader sweep in a single go. A contrast-enhanced mammogram or a magnetic resonance imaging scan might be even more sensitive, though they carry different costs and, in rare cases, side effects related to the contrast dye. Now, let's make another quick pause for an important moment. If the mixed emotions of frustration and determination have captivated you, and you want to hear more investigations that shine a light on hidden risks, consider subscribing to keep in touch. By doing so, you'll never miss a new deep dive into health, science, or pressing social issues that could shape your future. And with that, let's continue. Looking at the bigger economic and public health picture, one might note that detecting smaller tumors far earlier is typically vastly cheaper for health services than shouldering the expenses of advanced cancer treatment that might involve extensive chemotherapy, hospital stays, surgeries, and palliative care. So, from a purely financial angle, revealing breast density to the patient and considering targeted follow-up scans could actually be more cost-effective in the long run. Add the intangible benefits, namely people's peace of mind, their sense of control over their bodies, and the thousands of potential lives saved. And it's tough to argue against an overhaul of existing guidelines. Each story of a misdiagnosis adds weight to the call for transparency. Meanwhile, each success story like that of Louise, who discovered multiple tiny cancers through extra imaging, demonstrates how we are already capable of doing better. The technology is here, the knowledge is here. What remains is for the medical sphere to fully embrace the stance that every individual has the right to understand her own breast composition and the implications of it. Medical practitioners like Professor Gilbert are forging new paths, analyzing vast amounts of data to determine the best possible screening methods for dense breast tissue. The shift is not an abrupt upheaval, but rather a steady realignment of priorities, removing the guesswork from standard mammograms and injecting clarity into the process. The tension arises when, in certain official channels, caution about generating too many extra scans or fueling anxieties leads to indefinite delays and policy changes. For every year of delay, we risk losing more lives to undetected lumps lurking in that snowstorm. Yet hope remains. The synergy of determined patients, vocal advocacy organizations, legislative champions, and open-minded physicians can form the backbone of a movement that might soon reframe how we approach breast cancer detection. The shift from paternalistic medical paternalism, where doctors decide what patients can handle, towards a patient-centered dialogue is part of a wider cultural change. As we progress further into the 21st century, the call for transparency grows stronger, urging the medical establishment to recognize that good healthcare is not about shielding people from scary data. It's about empowering them with accurate information and a range of potential solutions. Now, as we near the end of this journey, let's recap. We started with that shocking statement, the idea that many women across the globe have died not simply because they had breast cancer, tragic though that is, but because they were never alerted to a factor that boosted their risk and complicated detection. We then discovered the phenomenon of dense breasts, how they can hide tumors in plain white-on-white imagery, how they create up to 6 times higher risk than normal breast composition, and how many women with dense tissue have been left unaware they may require extra screening. We've heard of real people who illustrate both the worst and best outcomes, from Susan, who found out only after her advanced cancer had spread, to Louise, who caught hers early, minimized her treatment, and returned to life with renewed optimism. We also pulled back the curtain on the differences between countries. The United States mandates that women must be informed in writing of their breast density, the risk, and the detection challenges. Other nations like France, Switzerland, and Lithuania also incorporate follow-up scans for those with highly dense tissue. Meanwhile, the UK's official screening protocols remain trusting of a single mammogram result, with little or no mention of the potential pitfalls of capturing images in a snowstorm. Critics assert that this approach fails to respect a patient's right to know. Although the Braid trial in the UK hints at a more progressive style of medicine, it remains to be seen if these lessons will be rapidly and systematically applied. Why does all of this matter? Well, because knowledge is more than power. It can be the difference between life and death. Understanding your personal risk, whether it's from dense tissue, family history, or lifestyle, offers a crucial head start in dealing with cancer. On top of that, the emotional well-being of knowing you've done all you can to investigate and either confirm your good health or catch a developing tumor early is beyond measure. The heartbreak comes when, after a belated diagnosis, patients exclaim, "If only I had known." So, the biggest question swirling around is, what next? Perhaps new policies will ensure women automatically receive their density classification, along with an explanation of the significance. Perhaps ultrasound clinics and MRI scanners will be more readily available and covered by health insurance or government funding for individuals at higher risk. Maybe even the technology itself will advance, with new types of scanning that do an even better job of peering through that veil of fibrous tissue. In the end, progress rarely happens overnight, but the stirring of activism around this issue suggests that we are on the brink of a turning point. In the meantime, the best advice for anyone who suspects or learns she might have dense breasts is to remain vigilant and proactive. Talk to healthcare providers, ask direct questions about density levels, request alternate or supplemental imaging if you have significant concerns, and push for solutions without letting bureaucratic processes stonewall your right to comprehensive care. There are dedicated organizations and patient advocacy groups that can offer guidance and support, and their vision for a clear, honest screening environment might become the new normal sooner than we think. That brings us to the close of today's deep dive. We've examined the root of the problem, shed light on the science, introduced the real-life stakes, and shown that solutions are within reach, but it's up to each individual, each medical official, and indeed each policymaker to decide how swiftly or slowly we proceed. No one should have to learn about a hidden risk factor only after the worst has happened. Instead, may we strive for an era when everyone is fully informed and empowered, with no more snowstorms concealing the truth. Thank you for immersing yourself in this urgent topic, and I hope each of us can carry this knowledge forward to spark real change.